Good morning. Today we're going to talk about the patient who comes to me and says, I don't know if I want my neck cracked, or I don't know if I can take a forceful adjustment. Well, fair enough. Who are these people? And what are the things that we can do that are what we call non-force? Because remember, we want joints to move, we want muscles to stretch, but there are times, and there are people that don't tolerate a full, what we consider, adjustment. Who are these people? Well, first, a lot of times there are seniors and our older people, and the bones are thinned, the joints are more delicate, shall we say, and so forceful manipulation may not be indicated in these people. The other people are younger, but yet the joints have been so beat up over the years that they're now fixed and locked down, and you can feel it. You can just say, God, I'm so stiff all the time and I can't turn and I can't move. And in those people, sometimes forceful adjustment cannot overcome the fixation that already exists in the joint. A third group might be infants or small children who have great joint mobility, and we just want to continue that joint mobility, and they don't need a forceful adjustment to begin with. So how do we accomplish this thing called non-force or low force technique? Well, there are 3 or 4 ways to accomplish it, and I'll talk about them briefly. One is we can just simply do something called a myofascial release. What does myo mean? Myo means muscle, fascia means face, so the face of the muscle. And we literally stretch all the muscles as they're attached to the joints. And we give those muscles as much of their normal range and as much of their normal tensile and what's the word I'm looking for here? The ability of the muscle to stretch through its normal range. So we want to do that, and we can use myofascial release for that. The second way we can do it is we can use something called an activator. An activator is a little clicker gun, just like this, and it literally gives an impulse into the joint. And if these joints are just out of alignment a tiny bit, this will give enough force to push that joint or to adjust that joint, manipulate that joint back into place. So that's called an activator. And typically we use this in the very young and the older patient population. A third group are going to be stretching exercises, range of motion exercises, where I will take the joint itself and the muscles attached to that joint, for example, hamstrings, and I'll stretch them through their full range of motion. And I'll take them back. And then maybe I'll oscillate them to open the joint up and allow the joint to increase its lubrication. So these are all ways that we can facilitate in a non-forceful, non-invasive way the mobilization and manipulation of joints in populations that do not tolerate forceful adjustments or manipulations well. I hope you learned something. If you need to, follow up with us at the office and we'll go over it with you in more detail.